Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Yet another day to begin, and this entire month we would talk about antenatal care. That is actually what is the essence of pregnancy care. Why do we actually need to have pregnancy care is an important question. So many conditions in pregnancy are preventable. An early detection of any medical problem or any problem that is related to the pregnant woman can be treated. It not only, prevents infectious diseases, it also has a look over about problems like hypertension, diabetes, preeclampsia, and all these things in pregnancy. It also has, a screening for problems like anemia, and it also emphasizes on the role of vaccination during pregnancy, and also it is a time of in a woman's life where the woman actually goes to the hospital. So even you have to look into a chance not to forget about cancer screening, like doing pap smear examinations, breast examinations, an ultrasound that reveals if there are any problems. So there are several aspects to antenatal care, and it is all about antenatal care and how you take your antenatal care, and how without involving your own self in terms of seeing what is happening in your body through Google or through friends or maybe through your relatives. I always tell my pregnant women to look into pregnancy actually with your own bodily changes. The problem that is happening is either they follow friends, or either they follow their relatives, or either they follow follow the rules and regulations or the experiences of their of the other adults in the house, or they follow some books, or they follow some websites. But essentially, women are forgetting the point that they should follow their basic instinct, and they should follow the pregnancy symptoms and signs what the body is showing. And this is almost forgotten. For example, I'll tell you, whenever a woman comes for an early checkup, a very early first checkup, she keeps asking that, doctor, I don't have any vomitings, doctor, I don't have any symptoms. Or somebody who is having 20 vomitings a day, they'll say that, why am I having so many vomitings, doctor? My friend had only 2 vomitings a day. So it is actually killing the instinct of your own pregnancy. So you should experience your pregnancy, your child, and your emotions and everything without bias. So it is important that we actually enjoy our pregnancies without bias. And when we do in that way, you will know what is happening in your pregnancy, and your pregnancy being a unique phenomena for yourself, you will know it as a whole experience rather than through somebody else's eyes. So it is very important that you perceive your pregnancy as an individual pregnancy by itself, and never ever compare with any other pregnancy. And the doctor per se also does the same. You know what experience of yours, the 22 years of experience that I have seen maybe more than a lakh pregnancies in my life, but I have never given the same treatment, same advice, same talk, emotionally connecting to the pregnant woman of the same category to 2 women. Maybe the pharmacy drugs would be the same, iron, calcium, and DHA. But as a matter of fact, when we ask, what are your complaints? What are your experiences? What are your, what is your body telling us about things? So we always in medicine look to that variability, look to the thing when we can judge people individually and give individual advice. And it is never the advice just given randomly to all of them together. Yes, you can commonly tell few things like this can help, this can help, this can help, decrease nausea and all these things to a common gathering or to everybody. But what works for them is an individual part, and you should respect that. And it actually is the essence of antenatal care or pregnancy care, to individualize women and to give individual care to every woman is the essence of antenatal care. And it is very important that anybody who is watching this, they are fortunate to have a gadget in their hand, fortunate to have an opinion, they're fortunate to have so much of information. And antenatal care is not so fortunate for everybody worldwide. There are several countries, several villages, several women who are expecting and they are not able to come to a hospital for antenatal care. So that you should have that gratitude that you have doctor support, you have availability of resources, you have opinions, and you can execute your choices with whatever place and frame of mind you are. So it's really speaking, in the world that we are living today, it is actually fortunate to have some doctor to take care of you, or some midwife in different parts of the world to take care of you during your pregnancy. And especially in places like India, you have several doctors to cater to you at the same time. You can take a second opinion, you can take a third opinion, you can take a fourth opinion on whatever issues that you have. But antenatal care or pregnancy care, it was more of a trust driven phenomena in the past. And if you have enormous trust on your doctor, you will have a super pregnancy and it will be an enjoyable one. And trust is something that you essentially have it in you. So you should be able to trust people, and yes, on the other side also the person should be trustworthy. But the moment you give yourself, without bias into your doctor's hand, that is when you have to take a decision that you will abide by whatever the doctor says, and you should stop googling things and stop verifying things and stop questioning whatever doubts that you have, because you can have a position to clear your doubts, but you cannot doubt the treatment. Because in a matter of fact that I have tell you that two doctors would never give the same treatment, never give the same opinion, because they think differently in a different situation. So second opinion, third opinion, fourth opinions do not match always. At times they match, but they do not match always, especially when it is about pregnancy. Everybody has their own experience and own methods of dealing with things. And antenatal care is something really, really important these days, because it helps in identification of problems, it helps in close monitoring of women. It also recognizes problems like hypertension or BP in pregnancy, that's called preeclampsia, diabetes in pregnancy, and several other problems that easily can be identified. And if you have a problem already existing, maybe diabetes, maybe epilepsy or any other thing, you will be able to have a very closer monitoring. And antenatal care is important, and every aspect of a pre-existing illness, you will have different kind of care that is given to pregnant women. So that is another thing that pregnancy care happens to do. If you have already an existing illness, then it's a team effort. It's not only the obstetrician's effort, it's about the physician's effort. If you have hypertension, it is about the neurophysician's effort. If you have epilepsy, if you have diabetes, it is endocrinologist effort. So it's a team effort, and antenatal care with a pre-existing problem goes in a team care. And pregnancy care is so much complicated at times that you have to take care of yourself, you have to take care of your diet through a dietitian, you have to take care of your physical health with people who teach yoga or people who teach exercises, Lama's childbirth education exercises. all these things. And at times it is a team effort when you deal with the other problems also. And as anemia is one of the most important problem that we are dealing with nowadays, it is important that screening in terms of blood tests on a regular pattern for your blood percentage, for your sugars, for your chances of any sexually transmitted diseases like HIV, hepatitis, syphilis, hepatitis C virus, and all these things have to be done. And your antenatal care pattern, we will be discussing on a regular basis. Eventually, in the morning sessions from tomorrow onwards, we'll have different topics. But why antenatal care is important, how important it is, and how dedicated women should go towards antenatal care is what I wanted to discuss today. And it is not about only the woman coming for the antenatal care. We had enough discussions in the last time that husband or the partner should be accompanying the woman along with the for the checkups, because anything that is given as a form of instructions, it would also be helpful if you have a helping hand to listen to. And it is very important that if they're not a nuclear family, if they have family members around, they can also call their family members for the antenatal checkup, so that there'll be somebody to listen to and take notes and carefully look into the pregnant woman's life. And it is important that the family members also know what is happening in the pregnancy and how they can take care of her and the unborn child, or in terms of medically improving their outcomes. And during the antenatal care or the pregnancy care, we even give a little bit of knowledge into how to take care of the child and how to take care of the newborn. And essentially, newborn handling sessions are there, and what are vaccinations, how are vaccinations going to help, and what is all about breastfeeding that you learn during antenatal care. And essentially, when you have very good quality of antenatal care, everything is done. Pregnant woman, it is not only about bodily changes, it is about the changes in the mind, it is about the changes in your responsibilities. It is about the changes that are going to come into your life in terms of additional workload and all these things. So it is about physical, mental, emotional, and social well-being of the pregnant woman that we have to look forward for. So physically, you can identify problems and you can give therapy. Mentally, they need a lot of counseling, lot of support, lot of positive notes to talk about and support. And emotionally, it is a very labile condition. Pregnancy is a very labile condition, and they have emotional outbursts, they have crying spells, they are very emotionally labile during pregnancy thanks to the pregnancy hormones. So it is very important that the family members and husband are in support and emotionally support the woman. And also socially, it is important because it's a phase of life that is exciting for the entire family, friends, and socially also there are so many customs, rituals that are helping pregnant women deal with. So socially also you need to connect antenatal care for the well-being of the pregnant woman. And so is the health definition of health. It is not only about physical, it's about mental, it is about social, and it's about emotional well-being that is important in pregnancy. And if there are any issues at home, you have to have counseling sessions and dealing sessions with that. And antenatal care, it is also important that you make their home, the home place also safe for the baby to come in. Any small issues you need to deal with, and any tips and tricks for the taking care at the home, safety measures to be established at home, all these things are an essential part of pregnancy care. And it is very important that pregnancy care covers so many aspects, because unless and until you give importance to these kind of aspects, it would not be a complete kind of antenatal care. uh, you should always have an impact on how to make pregnancy a safer area, and how to the counseling sessions should include to identify problems that can be a danger sign that needs to be identified, and when to report to the hospital or how to report to the hospital is very, very important. And the important message goes is, if you have find any danger signs, what are the danger signs, and how can you identify the danger signs, and how to reach out to the hospital, and emergency numbers, and all these things should be a part of pregnancy care. And actually, it's a part very, very interesting, that emotionally also you should prepare the woman and the husband or the partner to get ready for the child, and get ready for the responsibility of being parents. So this is also a part of antenatal care or pregnancy care. And there are several methods of dealing with antenatal care. Usually, if it is in the books, it's very bookish, but yes, antenatal care or pregnancy care is differently planned for everybody, and it does not have a monotonous way, because your day-to-day examinations in the hospital or the doctor's clinic is going to reflect when or how frequently you should come for the antenatal checkups. Usually there is a pattern that every month once you need to come for about 7 months, and the 8th month you need to come once in 15 days, and the 9th month you should come weekly. But then this pattern is not always correct. It is very important to understand that maybe this pattern was there with your parents or with your other elders and all that, but nowadays we are seeing a lot of problems in the first trimester, like thyroid issues, like bleeding, like history of miscarriages, previous miscarriages, history of placement of pregnancies at an abnormal location. So at times in the first trimester, we are in fact calling them once in 15 days, depending on their medical condition, to come for checkups. So it is not always once in a month. And I see people asking me that, doctor, my elder sister went once in a month for the initial few months. You're asking me to come little more frequently. Then I substantiate and corroborative evidence saying that I don't know about your elder sister, but you have thyroid issue, or if you have twins, I need to monitor you little more frequently, or you've had a very high sugar value, I need to check your next sugars very closely, so I need to see you back again in a week's time. Or maybe there is a change of medications that I'm looking forward for. So there's so many things, and antenatal care or pregnancy care is not the same for everybody. It is always dependent on your condition at that point of time, and your requirement of the next process is that which governs the pregnancy care. So antenatal care is something really, really important, and when you look for good antenatal care, it is important that you give your 100%, and you follow the doctor 100%, and do not get the other things entering into your mind and spoiling your pregnancy routine. And it's very, very important that antenatal care giver or care is essentially covering all the aspects, as I have told you: physical, mental, social, and emotional well-being is covered. You are having access not only to the general medications that support you, you're also having access to education, you're also having access to screening modalities of prevention of cancers or identification of problems, or you are having every modality of screening any infectious diseases, or you are taking care of your physical health by yoga or Zumba or some kind of an exercise, or Garb Sanskar yoga or anything of that sort, to give you that support and healing from inside. And you have access to good dietitian support, and actually what diet suits you. That's very important. Giving you some kind of a fancy diet is absolutely not correct. You should stick to your local diet patterns, your seasonal diet patterns, your traditional diet patterns, because those are the ones actually you have to start reflecting on your unborn child, so that when the baby delivers, they will be identifying themselves with that kind of a diet pattern. So you should be as closer to yourself as possible in terms of your traditional food, and you know, as closer to nature as possible for a sustainable living. And it is, earth is all of us, and it belongs to us, and it is very important that you safeguard your own planet, because it's the future of your child that you're looking forward for. So this is a small talk on essence of antenatal care or pregnancy care. We will have individual topics that we're going to talk on a day-to-day basis in the morning session, 7:30, super healthy super mornings with Dr. Shilpi. And if you have any special requests or special topics that need to be covered in terms of pregnancy care, you can post here, and I will be talking about those topics, and we will cover them definitely, so that everybody will be involving in these kind of discussions, which are eventually going to be very helpful, not only for you, even for your loved ones and close people. So it's all about antenatal care, and it's the season of Mrs. Mom, and Mrs. Mom is ready to start end of November. The registrations are on. You can register to Mrs. Mom. I am wearing a Mrs. Mom t-shirt. So it's all about pregnancy. It's all about enjoying your motherhood. It's all about learning new things in pregnancy. And Mrs. Mom is a crash time for the whole week to learn everything beautiful about pregnancy and make memories. So do register for Mrs. Mom, and see you tomorrow morning, 7:30 live.